Welcome to the Big Sky Care Connect Health Information Exchange User Training. This training is designed to familiarize you with eHealth Exchange and how to view medication data in the HIE. This project is funded in whole or in part under a contract with the Montana Department of Public Health and Human Services. The statements herein do not necessarily reflect the opinion of the department. This information and materials are copyrighted by Big Sky Care Connect. All rights reserved. All materials are provided for non-commercial, personal use only and may not be copied, duplicated, altered, or transferred to any medium whatsoever. This training is designed to help you get the most out of your health information experience and may contain some features not available to your organization. If you have any questions over the features in this training, please contact the Big Sky Care Connect Help Desk at help@mtbscc.org or call 888-937-7396. In this training, you will learn about the eHealth Exchange, Doctor First, and how to view medication data within the Big Sky Care Connect HIE. First, let's discuss eHealth Exchange. The eHealth Exchange is a public-private health information network and is the largest of its kind in the country. The eHealth Exchange network spans all 50 states, supporting more than 120 million patients. Approximately 75% of U.S. hospitals and 61 health information exchanges participate in eHealth Exchange, including Big Sky Care Connect, making the evolution from point-to-point connections to a one-way gateway solution that dramatically increases connectivity for the entire country. This network connects federal agencies, such as the Centers for Medicare and Medicaid Services, Veterans Affairs, Department of Defense, Health and Human Services, and the Social Security Administration, to transact with private sector providers, in addition to non-federal organizations such as regional and state HIEs. Patients visiting Montana may find themselves in need of urgent care due to an injury or acute illness. For example, Montana is a state often visited by tourists who enjoy winter sports. Bob is visiting Montana. He typically receives care back home from his provider, whose practice participates in his state's regional HIE. While visiting Montana's Whitefish Mountain, Bob has a ski accident that requires an emergency department visit for a possible broken arm. Bob has broken this arm in the past and informs the emergency department clinician that his home provider should have the x-rays from his past break. Through the Big Sky Care Connect HIE connection to eHealth Exchange, the clinician can run a query and retrieve any imaging reports available through the network. With this bi-directional exchange, the emergency department clinician can access the previous imaging study reports and compare with the current imaging, and Bob's home provider will also have access to the new imaging reports for follow-up care when Bob returns home. Big Sky Care Connect is also currently seeking a partnership with the Strategic Health Information Exchange Collaborative, or SHEIC, Patient-Centered Data Home Initiative. This Western Region partnership will allow regional health information exchange between HIE members. The Western PCDH acts as a hub with other regional exchanges, including the Heartland, Midwest, and Central regions. Exchange is based on ADT alerts and zip codes. Next, let's discuss Doctor First. Dr. First provides medication history information, providing clinicians with complete, consumable information to provide the best care for patients using the MedHX platform. Big Sky Care Connect users can search the HIE for a patient they are treating to view a concise and comprehensive health record that will now include thorough medication history information. Having this information will help identify and avoid adverse drug reactions, improve medication adherence, and prevent avoidable readmissions. A patient's search results will list Dr. First in the identifier column as a data source, if applicable. You will also see the medication icon listed for the patient, if that data exists. When the patient is first accessed in the system, you may see a message in the banner stating, "Awaiting results from Dr. First." This is an indicator that the medication information is being pulled into the patient's record. When "Done" is displayed, refresh the screen by selecting the refresh link in the banner. Dr. First updates the patient's medication data every 4 hours. Now let's see how the medication data is displayed in the Big Sky Care Connect HIE. As you may recall, when you select a patient from your search results, you are taken to that patient's clinical summary screen. The clinical summary displays 6 quick glance sections of information, including medications. Each section displays the 5 most recent results for the patient, if it exists. Each section also has a tab on the Chartbook menu for you to view more information about that topic. The Medications Quick Glance section lists the name of the medication. You can select this column heading to sort by the medication name. It also lists the start date. Select this column heading to sort by date. Details are also listed. By selecting the 3 dots in the Details column, you can view more details about the medication. The top of the Medication Details screen displays the name of the medication, the drug form, the dose, form, and units, frequency, and duration. This is helpful to get the important information quickly about this specific medication. The administrative section of the details lists the dose form, units, drug form, route, frequency, duration, number of refills, indication, order status, start date and time, end date and time, and fill date and time, if that information is available for the medication. The Order Notes section of the medication details lists any comments and text instructions. Text instructions will be helpful to review to know how often the patient is to take the medication. The Order Details section lists the priority, ordering clinician, authorizing clinician, entered at, entered by, and date and time written. You can also access medication information from the Chartbook menu located on the left of the clinical summary screen. Click on the Medications tab to open that detailed section of the patient's longitudinal record. If medications have a start date within the last 90 days, they will appear under the Current Medications section. Medications older than 90 days appear under Historical Medications. You can search both sections and sort results by date and/or medication. The tab includes the name of the medication, the source of the medication information, the ordering clinician, the start date provided by the source, and details. Sometimes you may only see a number for the ordering clinician. This occurs if the clinician information sent from Dr. First does not appear in the active directory. To sort by medication, select the medication column. This groups the medications by name. You can then sort by the date column to easily see how many times the patient has been prescribed a specific medication. Select the 3 dots in the Details column to view the medication order details. This is the same detail screen that can be accessed from the Clinical Summary Quick Glance screen. Return to the Medications tab by selecting the Back to Chartbook button located at the top of the screen. We have learned about the eHealth Exchange and Dr. First and the benefits they bring to the Big Sky Care Connect HIE and how to view medication data. If you need further assistance or would like to learn more about Big Sky Care Connect and the HIE, please reach out to us and we will be happy to assist you.